One of the challenges with end of life is accepting that the chances of cure, the chances of surviving that disease are no longer with us, and that's the hardest bit. But that sometimes can open up into a more open dialogue between you and the person you are looking after. And again, the first thing to say is to listen, is to ask that person, what's bothering you? What would you like to chat about? Are you frightened? If we've got a certain time left and the things that you want to do, what might we do? What are the things I can finish off, or we can finish off together, so to speak, in that way? End of life shouldn't be all about the worry about pain or other symptoms. There are many good medicines and other treatments, such as radiation therapy, which are brilliant at controlling end of life symptoms, particularly for patients who have cancer. So I think, again, being that advocate in a way. Don't be frightened to ask the harder questions. What might they want at the end? What might a funeral look like? What might wishes for afterwards look like? And the very practical things, such as, have you made a will? Now, those are not all questions to ask on day one, but that's as time goes on. And I think the final thing is to try as best you can, through all the grief and sadness, to enjoy their time. There will actually be some good times. There will be some funny moments, bizarre as that may seem to be. There may also be some sad moments, but to try and make the most of that, because those memories you will look back to after your loved one is gone.
So end of life is obviously very distressing. It's important that people be linked in with palliative care services that might be in the community, might be in the hospital, but also be linked in well with the general practitioner too. Palliative care teams are there not just for the person diagnosed, but for family members, for friends, and they're there at the time as people are dying, but also after someone's died as well.
Patients and their families are at the most vulnerable when the end of life is imminent. I think the first one is being clear that the patient and the caregiver know what they would like. And by that, often it's, does the person want to have their end-of-life care at home, or do they want to be at home for as long as possible, and then know what the options are to go elsewhere, and give them permission that both are okay. Nobody can give end-of-life care 24 hours a day without having some help, be it from palliative care, other family members, or other people in the community, and that's okay, but the carer needs to be cared for as well as the patient. And the need to, sometimes they will need prompting to step out, even if it's only for the shortest spaces of time. The best caregiving for carers is doing the things that gives them joy. If it's going to exercise, if it's talking to the cat or the dog who won't answer back, if it's going out once a week out of the home to meet somebody just to have a conversation, going to an art gallery, painting.
Try not to spend all your time updating family and friends as to how your loved one's going. Think about other strategies like having a Facebook page or a WhatsApp group, or nominating an alternative family member to provide regular updates. Otherwise, if you're the one doing that all the time, it can be very tiring. So where you can allocate duties or roles to other people, it's usually a good idea to do that. It's really important in this remaining time that you and your loved one have together to really do the activities that you find meaningful. If that means reminiscing about the past, watching a lovely movie together, singing, do any of the activities that you've always derived some sort of enjoyment from. It's also a time where, as a carer, it's important to seek out any support you may need, either formally or informally. Be open to help, so if help is offered, think about what's actually going to help you the best.